Our team is submitting a comprehensive grant proposal to address the high rates of adolescent and young adult HIV and AIDS infection in Durban of the KwaZulu-Natal province in South Africa. South Africa currently has the highest number of HIV and AIDS positive individuals in the world, with 8.2 million infections. Within this population, over 50% of people are between the ages of 15 and 24. These alarming statistics demonstrate the need for a more comprehensive and targeted approach to HIV/AIDS prevention, which we hope to achieve with the help of grant funding. Our 3-year initiative aims to establish a community-based education and prevention model in 100 Durban area middle and high schools in an effort to reduce HIV and AIDS infection among young adults. We plan to utilize our team of educators to develop and teach a safe sex curriculum that will enable sexually active youth to better protect themselves against HIV. Additionally, our team will provide a supply of condoms to each target school with aims of increasing proper and frequent use. Data will be collected biannually, and follow-up trips to each school will be conducted, which will provide data to be utilized to tailor the current program curriculum and make recommendations for future interventions. Our program will take place over the course of 3 years. The first year will be spent building relationships with target schools and presenting the benefits of our prevention curriculum. During this initial phase, our educators will collaborate with school teachers to ensure curriculum understanding and program sustainability. The next 2 years will consist of check-ins every 6 months, which will include data collection and observation of program progress. The program will conclude at the end of the 3-year period, where we will assess overall performance and impact. For our 3-year program, we will need 1 full-time education training manager, 1 full-time administrative coordinator, 1 full-time research analyst, and 10 part-time curriculum educators. All of the educators we provide will be from the United States. There will be biannual condom distribution, and money will be set aside for teaching supplies and textbooks. Our management team will consist of our education training manager, administrative coordinator, and data analyst. Our educators will operate under the direction of this team. The total cost of our initiative will be $2,652,982. The current programming to address HIV and AIDS in South Africa work mostly at a national level, while our program will work specifically within the Durban school system. This will allow our educators to build real connections with the students at the schools, and we will be able to adapt the program to the specific needs of each set of students. Logistically, it is very difficult for large programs such as the United States President's Emergency Plan for AIDS Relief to identify and fix possible weaknesses at a community level. However, our program will be small enough that any problems can be addressed quickly and efficiently. Another key aspect of our program is that its focus is on education and prevention of HIV. South Africa has the largest antiretroviral treatment program in the world. The use of these medications is essential to end the AIDS crisis, as it prevents those infected with HIV from developing late-stage health issues and lowers their ability to spread the virus. While this is incredibly important, national programming focuses much on individuals who have already contracted HIV. Our focus addresses this issue with a more upstream approach, reducing HIV cases by preventing individuals from being exposed in the first place, at a time when many young adults are newly sexually active.
Immediate interventions in the young adult population are imperative to reducing HIV transmission. A recent survey conducted in KwaZulu-Natal revealed that 11% of young adults were able to display a comprehensive understanding of HIV risk factors. Within the same survey, only 25% displayed an adequate understanding. In South Africa, over 69,000 young women and 28,000 young men were identified as being HIV positive in 2018 alone. The combination of minimal HIV/AIDS education and extremely high infection rates demonstrate the urgency of this problem among South African young adults. Without immediate educational intervention, HIV and AIDS rates in the young populations will continue to rise and stay at high levels. We believe that our proposal will have a high likelihood of achieving our goals because the timeline, scope, and budget make the program feasible. The 3 years of time allotted for the completion of the program gives us ample time to achieve our goal of educating 100 middle and upper schools and making sure that the program is being upheld. Our target population of 100 Durban area schools is not overwhelming. It is large enough that it provides a base of individuals who can significantly contribute to the reduction of HIV and AIDS cases. The 10 educators that we provide will be well-trained and thus have a tremendous effect on the educators in the area. By taking the time to efficiently educate the staff in the area, our program will grow the number of people well-trained in HIV prevention measures. Twice a year, we will conduct check-ins and conduct data analysis, surveys, and interviews to evaluate program effectiveness. This will allow us to continuously assess our program, the progress it is taking, and make any changes needed after each check-in period. Should changes be needed, our educators will communicate with the management team to determine how we can best tailor the program to reflect our population's needs.
Our project aims to achieve 2 primary goals. Firstly, we hope to reduce the incidence of HIV within our population of 100 schools by 10% within the 36-month duration of our program. We will monitor this goal by utilizing statistics on infection rates and condom use among students in our schools. Secondly, we hope to achieve sustainability in our model of prevention education. If the majority of our 100 schools agree to continue administering the prevention education curriculum that we have developed, we will have achieved this goal. In considering incidence reduction in our program's future, we will strive to use both these factors to positively shape how sexual education is approached in South Africa. It is imperative that young adults have access to evidence-based prevention information and a reliable supply of condoms. Creating an environment in which safe sex and reliable information is prioritized will inevitably improve the overall health of young adults in South Africa.